Well, the World Economic Forum has put a number on something governments have ignored for decades. Aging badly is expensive and fixing it is cheap. A new report from the WEF and March, released as Summer Davos opens in Dalian, makes a blunt case. Simple home safety improvements, physical activity programs, and even access to hearing aids could prevent nearly 400 million falls, 8.5 million new diabetic cases, and 2.4 million dementia cases by 2040. The payoff, over $5.8 trillion in healthcare savings and $645 billion in productivity gains. Well, break down the math and the asymmetry is stark. Home retrofits, rock tape, stair lighting, and even grab bars could actually prevent 400 million falls and deliver more than $5 trillion in healthcare savings. Again, that is against less than $400 billion in upfront global investment. That's roughly a 13-to-1 return for fixes that cost less than a hotel minibar. The diabetes case is similarly lopsided. Community physical activity programs costing $1 to $40 per person could prevent 8.5 million new type 2 diabetes cases across the globe, returning over $125 billion in productivity gains and $85 billion in healthcare savings. China alone could add as much as 16 million healthy years for people over 50 years. Hearing aids close the trifecta. Fewer than 20% of the world's 400 million people with hearing loss have access to hearing aids, despite the now well-established link to dementia risk. So the question is, why isn't this happening at scale? The report's real findings is not medical, it's institutional. Governments and businesses manage health, finances, and labor participation, separately leaving trillions on the table. And the gender cost is explicit. A year of caregiving combined with the gender pay gap can cut women's retirement savings by 24%. This essentially lands at a politically loaded moment. The IMF has just trimmed global growth forecasts to around 3.1% for 2026 and has cited geopolitical risk against that backdrop. A 13-to-1 return sitting unclaimed because of bureaucratic silos isn't just a health story, it's a policy failure with a price tag. A correspondent, Dharamjot Kaur, has sent us this report from Dalian in China.
Health is wealth is a statement that we have heard far too long, far too often. But here in Dalian, as Summer Davos unfolds with many stakeholders and state leaders present over here, the World Economic Forum is making a case for bringing the two together and doing so in an economical manner. Now, this report talks about low-cost, effective measures and policies that can benefit global healthcare systems to the tune of almost $6 trillion, and it can also increase productivity for economies across the world by more than $600 billion. What are these methods that we're talking about? The methods essentially hinge on bridging the gap between labor policies and health policies, which involves lowering a lot of costs for hearing aids, supplying them to the millions of people who need it across the world. The policies, according to the study, also talk about bringing down accidents of millions of people inside their own homes, and this involves foolproofing systems inside people's homes. Small steps, but all of them compounded together can save global economies billions of dollars by the year 2040. The question, of course, now is how do countries come together to bring about these policy changes and reforms? And what exactly will the benefit really trickle down to in terms of the millions of people that we're talking about? Will it be as foolproof as the report says, or are there going to be other challenges that cripple in and seep through these discussions over the course of the next few years? Here in Dalian with video journalist Joy, this is Dharamjot Kaur for WION World is One.